Hello, you're welcome. Let's just wait for a few more people to join us. Thank you for joining. Good evening. Thank you for joining. So let your friends know that we are live. So I can walk right through it. You change what's wrong with perfect love. You rescued me and I stand and sing. I am a child of God. You are welcome. You rescued me, I stand and sing. I am a child of God. Hey, you're welcome. Welcome to today's live session. Today we'll be having Dr. Illesanmi, our very own Dr. Illesanmi, and it promises to be an exciting time. Thank you for joining again. The focus of today's session is basically to ask questions and get answers on issues regarding fibroid. Now, hey, welcome. Thank you for joining. Something really interesting I want to talk about before our doctor comes here today. Hello, Heavy D, welcome. Nice to see you again. Woo, thank you. All right, Dr. Illesanmi in the building. While he tries to join us, I'm just going to tell you quickly what is happening, what we are working towards. I know you've heard it over and over again, but hey, it's the charity work team Speak Up. And the goal is to get each and every one of us at ease with talking about how we really feel, right? So today, we're going to be having Dr. Illesanmi join us, ask us questions. So you need to click on join, ask to join the live stream, something like that. Ask to join, request to join so that I can accept it. Okay? Just like the other time. So, as I was saying, the work is almost here. Thank you so much for joining. We appreciate you. The work is almost here. The Abuja version of the work will take place on the 6th of November, which is barely 1 week thereabouts. All right? For Lagos work will be on the 13th of November, and London will be on the 20th of November. Hey!
Hello, good evening.
Welcome. Good evening.
Good evening.
It's
Good
so good to
evening. How are
see
you?
you. Well, I'm very well, thank you. And you?
Thank you. I'm good, thank you. I'm good, thank you. Oh,
Amazing.
awesome. Thank you
Amazing.
everyone for joining us. You were telling us about the charity walk in November.
Yes. And I said that's the
Amazing.
goal now. That is the in thing. So registration will be out this week. You will be expected. Oh, there's even the registration going. It's ongoing. Just click on bit.ly/walk and talk participant 2021, and you would have
That's right.
successfully, registered. And if you don't want to walk yourself, you can sponsor a few other women, 5, 1, depending on what your capacity is, so that you can gift another woman the opportunity to share. Okay, so bottom of your screen, you'll see something that looks like a camera with a plus sign in it. Just click that plus sign. It looks like a camera just beside the add comment. It looks like a plus sign. Just click on it so that I can add you to the live stream. It says request to join. Request to join.
While we're waiting for Dr. Shegzi, so like Mavi said, the walk is in November. Abuja one is the first one, is 6th of November, just around the corner. If you're in Abuja, please join us. We're excited. It's gonna be fun. We have some wonderful, awesome people, doing work, on the Lagos, Abuja, and London one. And the London one, sorry, the Lagos one. The Abuja is the first one, is the 6th of November. The Lagos one is on the 13th of November, and the London one is the 20th of November. If you're in the city of Abuja, join us on the 6th. If you're in Lagos, please join us on the 13th. And in London, it's 20th of November. The link to register is there. Please register to join the walk, get a t-shirt, just let's create awareness. Let's create a campaign. Let's the different people who need to know, the government, the different bodies and institutions, regulatory bodies, this is a major thing affecting women, and so that something can be done and women can be helped. Let us speak up, as women, and get the help that we need, basically, and create awareness around fibroid, because it's really a major thing, and it needs to be seen as important,
a major thing. Yeah,
absolutely. So please join us.
It's no longer something to be shushed about. It's no longer something to shush over or about. We should talk about it more. So, Dr. Shekzi, can you see the plus sign beside your camera?
It's not showing the invite.
Yeah, and I can't add you from here. You need to request to join. So you just see request to join live stream, something like that.
Or Dr. Shekzi, if you want to go out and come back in or something. If you want to log out,
that's another
log back in, and then
log back in.
The request to join. Yeah. Maybe that will help. I have a few questions, obviously, today that I really want to ask. Some burning questions that I want to ask Dr. Shekzi, around fibroids and bleeding, honestly. And also, I just want to encourage people to absolutely register to do this work with us. We have some people who've been working hard, and also people supporting us. We have some giveaways. The other day, 2 days ago, someone contacted me and they wanted to be part of it. Like, they do a makeup range. They do their own label of makeup. And like, I want to give away some stuff, so because we have goodie bags, so we're going to give to women, doing the walk. And, someone said, I want to, donate. I want to be part of it. And we have other things going on, people giving, donations so we can buy feminine stuff like sanitary towels, spreads, body stuff, little things that women use and put nicely in a bag and give away, just to create awareness. And we're not ashamed. We're women. We use sanitary towels. It's what we use, part of what, we used to look after ourselves and be hygienic. So please come on, let's do this. Let's create this noise. Join us.
Yay! Dr. Illesanmi is here. It's good
really
to
sorry.
have you.
I can't seem to get it to work on the computer. I don't know whether I have to have the app on the computer.
Right. Okay.
Well,
so I thought about that. Maybe you were using your laptop or something. Anyways, easier on the phone.
I would just think it is easier to. Anyway, we're here now. Sorry, I'm really sorry about the delay.
That's all right. You're welcome. It's so great to see you again. How are you?
I'm fine. Thank you. How have everybody been? Everybody been good?
Yeah. So the charity work is what we're all about, and we're super excited about it.
That's good to know. Very good to know.
Thank you.
Even in the UK, we have 2 branches right now. So some people are doing Buckinghamshire, and also in Essex, in Thurrock, Essex. So we have 2 groups of working on the same day, in England. Okay. So awesome stuff. Good. And also, and if you're not in any of these cities, or if you're not in any of this town, like in Buckinghamshire, or you're not in Thurrock, Essex, and you're not in Abuja or in Lagos, or in or in Lagos. Please, you can
Abuja,
join
Lagos,
us.
or London.
Yeah, so you can join us actually virtually. So on all of those days, we'll be running the Zoom where you can join us and also participate in it. Also, and if you maybe are in a different time zone, because I know some women in the hub live in Australia and all of that, and you're in a different time zone from the time we're doing the work, please do a video of your work. Do your work as well. Do a video. Share it with us, and tell us what you were talking about with your the person you were working with. So it'll be amazing to hear
Absolutely.
those feedback from women doing the work. And also another thing to highlight is it's not just for older women, young women. My daughter's going to be working. A few of my friends' daughters are going to be joining us in the work. So it's for you, because remember that we're also creating awareness for young girls to know what to look out for, to educate themselves and to look after themselves. So we're including the younger ones as well to come on, and do this work with us, just to create the awareness, Absolutely. So thank you everyone for joining us. Let's go straight into it. Mavi, you take the first question, please, for Dr. Shaxi.
Okay. All right, Dr.
Thank you. Thank you
Shaxi.
very much.
Somebody wanted to ask that I don't know if there are different kinds of fibroids to start with, and if there are, which one causes infertility?
So, thank you very much for that question. In terms of fibroids and different types, always the sort of easiest way to maybe explain is I can probably use this my timer egg here.
Oh,
So
Dr.
the
Sexy,
thing to
always
imagine
ready.
is the thing to imagine is the womb will probably look about that shape, yeah. And you can imagine fibroids will be on top of the womb. It can be in the substance of the womb itself. So you know that there is going to be a cavity, so a space inside the womb, right? And then it can also be in the wall of the womb, or it can be well inside the cavity of the womb. So right inside the womb itself. Now, when fibroids are on top of the womb, in the middle, so in the wall of the womb, it's not unusual that people don't even notice the fibroid. It doesn't really affect much. Probably the size of the fibroid might become a factor later on. But usually people don't even get symptoms. But
Oh,
when the fibroid is going inside the womb, so inside that space,
inside
womb
the
itself,
womb. Okay.
it potentially, the way it affects fertility is it can stop the pregnancy
Baby.
from
Okay.
actually
From go.
implanting.
Oh,
So,
wow.
so the pregnancy from implanting, or just does not let it have a good medium to, so a fertile ground to actually start to grow from. That would be one way. And obviously, there can be other ways in that with the fibroid there, it is not unusual that it causes people some sort of heavy bleeding. And that heavy bleeding would mean that they never just get into the phase where they are looking to fall pregnant, or they might just not be in the mood to even try for a pregnancy, or they might be on treatment to solve the bleeding problems. And
Wow.
so that way they are actually trying to fall pregnant. So if you ask me for which one fibroid, the technical name would be submucosal fibroids. But basically, it's just the fibroid that is growing inside the womb cavity itself.
Right.
Wow. Wow.
Awesome. Mm.
Yeah, because I know that a certain good friend of mine said one of the reasons why she kept having miscarriage was because there was a fibroid right in her womb and it was
Mm,
big. I
mm,
don't know. I
mm,
don't know the exact measurements of that, the big,
mm,
But she said each time she took in, maybe while still in the first trimester, maybe within the first 6 weeks or so, she would
mm.
have a miscarriage. So it could be because of the positioning of the fibroid, correct?
Yes, it could be because of the positioning of the fibroid. Whilst there can be other reasons why people might miscarry, but sometimes what happens is you just try to look for you look for whatever clue you're able to find. So if you're investigating a woman and you now find that she's got a fibroid that is going actually inside the womb cavity itself, and the person has been having miscarriages, before you start looking for really fancy other causes, you would usually, before you start looking for fancy other causes, sorry, okay, before you start looking for fancy other causes, you would
Bless you.
usually, you would
We
usually,
understand.
yeah, yeah, yeah.
It's okay.
You would usually look for the common thing. So something common would be that fibroid growing inside the womb, for example.
Wow.
Interesting.
Wow.
Oh wow.
So so what
Amazing.
can be done about that fibroid?
Most times, people are able to remove the fibroid. So they would use a camera procedure, a camera with it's known as a hysteroscopy. So they can use through a hysteroscope. They will thread it through the neck of the womb into the womb,
Right.
see the inside of the womb, and then slowly cut away the fibroid.
Fibroid.
Yes. So
And this
this
is
would be
safe. It doesn't affect the elasticity of the womb.
no, it doesn't. It doesn't. It's actually the most should I say the most unobtrusive way.
Safest. Okay.
It's a
Oh,
way that you still
okay.
preserve the quality of
For the
the
woman.
womb itself. Because you're going through the vagina, through the neck of the womb with this camera, and the camera has got instruments inside it. And the instruments slowly, you can sort of slowly cut away the
My
fibroid.
goodness, that
So
must be a painful procedure.
it's usually done with the women asleep.
Okay.
It's usually done with the women asleep because you're using fluid to keep the place open, to keep the womb itself open. You're also using um, current, electricity,
Wow.
something to slowly burn away and cut away the fibroid. So for that reason, it's always undertaken with the ladies asleep. But it's the procedure itself is known as trans cervical resection
Oh
of
God.
of fibroid. So
So I got
Awesome.
so
I sorry, let me just ask this question real quick. I know of a lady who was told that her womb was out of shape. It was somehow out of shape and
yeah,
she needed to reshape it. Is there anything like that to reshape your womb so that it was turned inside and she needed to reshape it so that she could have a baby? I mean, she had struggled with fibroid uh,
yes.
and then she was told that her womb was shaped wrongly. Is that a thing? Is it possible for your
It
womb to be shaped wrongly?
well, I don't really know. You know, sometimes when people report certain speech, it can be difficult to
Yeah.
understand exactly. It can be difficult to understand exactly what they are meaning.
Okay.
Um, if you think of same thing, I'll show you this. So if you see the shape, so the womb itself, it's not unusual that it would be about that shape. Probably at one age of at a certain age in any woman's life, the womb will probably be about that size with the fallopian tube sort of sticking out on either side, that
Yeah.
way on either side. And with the way the womb would be like that, that would be like a probably normal shape, sort of like a pear shape of the womb itself. Um, but if I start adding things onto the womb, if I start adding like fibroids onto the womb, it starts to look a different shape, doesn't it? I
Yeah.
Right.
added fibroids,
Definitely.
do you see my meaning?
Right.
If I added something else, so that womb that was that nice, soft, smallish shape or nice,
Begins to take a different shape.
so
Absolutely.
Absolutely.
sometimes the fibroid can be such that it makes the womb even bigger than what the womb is meant to look like. So
Wow.
you'll find measuring the fibroids in terms of a pregnancy. So we might do something like the fibroid or the womb itself appears the size of a 20-week pregnancy, 24-week pregnancy, indeed sometimes 32-week pregnancy, and we're talking about six,
I
7, 8 months of pregnancy.
Wow.
Yeah.
I know. That's
Wow.
why you see some women's tummy so protruded, and you're wondering. Honestly, there was
What's happening?
someone that I knew personally, who them, and I didn't see them for I'd not seen them for years, and then one day I saw them, and honestly, I thought they were pregnant. You know, and I said,
Mm,
"Oh,
mm,
congratulations." She said, "What do you mean?" I'm like, "I'm sorry." You know, she actually looked pregnant, like she was,
mm,
7 months pregnant. And she's like, "I'm not pregnant." I'm like, "Oh my God, okay, you need to do something about this. You need to fix it.
mhm, mhm,
This is not right." And then I had a work colleague many years ago who actually thought she was pregnant. And she
Wow.
went on, yeah, she went on and on. And like, have you really looked into this? So that, oh yeah, I'm pregnant. I've been waiting for a long time. And like, did you do a pregnancy test? No, but I know that I'm pregnant. I'm like, And only for her to be told after many months that no, you're not pregnant. And it was fibroid. And that was very irritating, honestly. So I do know. I mean, even when I had my procedure, I was told it was as big as someone who was 20 something weeks pregnant. You know, I'm like, what? That's almost 5 months, isn't it? You know, so
Yeah.
yeah, definitely, definitely. Well, while we're talking about this, and earlier on you were talking about the procedure where you put thing into the uterus to look into it to. So someone wanted to ask, to if we could talk a bit more about radio frequency ablation of fibroids. Can you tell us a bit about what you know about that, Dr. Sheksi?
So so this is the thing with radio frequency ablation of fibroid. I guess the main thing for people to understand is different places. So I'm practicing in the UK, so that means we would use NICE guidelines, and with the NICE guidelines, the guidelines are usually written to just help women and doctors alike understand the evidence around any one particular procedure. People are beginning to find out that the radio frequency ablation of fibroids, which basically what it is when the patient is asleep, and for some other people under local anesthesia, they would insert an ultrasound device and point it towards the fibroid. And once they insert the ultrasound device pointing it towards the fibroid, they would now apply this radio frequency to ablate it. Ablate it means to sort of to melt it away or to burn it away. So that's why women will be asleep for the procedure. Um, Occasionally, people will be consciously sedated, they call it. So they have some sort of sedation where they can be easily awoken up. Um, the procedure itself, it is difficult to know what sort of success rates there are with it. Whilst it can work for some people, it is important to know it is not the answer to all types of
Everyone. I
fibroids.
remember we
And
talked
even
about
with
this
most,
a while back, actually, because you were saying, I think you were saying that, and sometimes it
yeah,
causes other damages, actually, that
Yeah.
you will not know on time. I don't know if it was you that you were talking about that a while back, that
yeah,
can also damage some other things that you might not
Yeah.
know
And
immediately.
cause, yeah, I
yeah.
remember. I remember. So it's not advisable, is it?
No, you see, this is the thing. There will be someone that invented this. There will be a center where they've tried it, where the doctors were taught,
Mm, mm,
taking them through the training.
mm,
The doctors have become more conversant with
mm-hmm,
using it.
mm-hmm,
Then they've a big group of women coming through and having the procedures.
mm.
The way they would describe it is um, it is whilst evidence will look for the efficacy. Efficacy is whether something works
Works
very
on
well,
okay.
and while they will look for like the safety.
Mm-hmm.
What people are able to know is that the main safety considerations that people look at is, oh, is the person bleeding heavy? Was there an infection? Did we tear the womb in the course of doing the procedure? And were people having to be readmitted into hospital? It is difficult. They've not found enough women
Right.
to be able to say, oh, this is the 100% data on what you should be doing with this. Many places they still use it in like a background of we're doing like a small research here, and we're
Right.
using radio frequency for some women, and for some other women we're using something different. Now I'm talking UK based.
Okay.
Obviously, in the US, where practice can be different, and maybe Canada, especially if people can get licensed privately, I would not be surprised if it is being offered. In terms of what women would probably want to look for, is you want to think of, okay, I've got fibroids and I want treatment. for my treatment, the kind of treatment I want is I want a treatment that avoids me having to be cut. So I don't want a treatment where they do an operation to remove my womb. I want to preserve my womb. I want to do an operation where, for example, they remove the fibroid, but I also don't want an operation per se.
Right.
So women will most likely go for this. Now, in terms of the limit, there will be a limit to the size that you're able to operate on using the procedure.
Wow.
And there would also be advice that they need to give about successful pregnancy
Oh.
after the procedure. When people have
Ah.
Oh.
reported successful pregnancy after the procedure,
Mm.
it will be one of those things that people will tell you. To be fair, the everyday myomectomy that you see done in Nigeria and in many other places across the world, when the doctors are taking the consent to take you in for surgery, they will have to warn about it as well. That look, we might do the procedure,
Yeah.
Can you be
and
child?
you might still not fall pregnant.
Mm.
We might do the procedure, and as we're doing the procedure, we might just find that the fibroids has really distorted the womb so much so that we almost
Okay.
have to remove the womb even.
Wow.
So it will be important that most procedures carries that advice.
Sure.
Warning.
Yeah. Absolutely.
Women with so once women are going for treatment, they would want to know, will it work for me?
Mm.
What will happen afterwards
Mm.
in terms of how long before I start feeling the effect?
Mm.
And after I felt the effect, will I need retreatment?
Mm.
And if I don't need retreatment, will it affect fertility going forward? And
Mm.
what sort of complications do people talk about more?
With
So, like
this
for some people,
condition.
they might be left with some sort of
Mm.
pain, not necessarily radio frequency
Yeah.
ablation,
Oh, right.
some other types of procedure.
Mm.
There are other common procedures that tries to avoid surgery too. So there's something known as uterine artery embolization. With the uterine artery embolization, basically what they do is with the patient, um, with the patient conscious, sedated or under local anesthesia,
Mm-hmm.
they would insert like a thin rubber tube
Dr.
through the
Shetty, can I
femoral
speak from
artery.
experience?
Yeah,
That thing is painful. It's as good as a
yes,
surgery. I don't care what anybody
yes,
says. That thing
Is that
yes.
is painful.
wow? They will insert the tube where?
They insert it into the femoral artery. The femoral artery is if you look down on your thighs,
Yeah.
Yeah.
the artery is just the blood vessel just right there that goes straight into your groin. So they thread the tube through that. Of course, they put local anesthesia at the top of it so that you don't feel the needle and the prick going in, and they you might not feel the rubber tubing going all the way
Ouch.
in. But what women would
Yeah.
complain about is that when they've deposited these small embolization particles, they are called, so something to just block the artery, so the blood supply to the womb on either side. When they block that, it is aiming to reduce the blood supply to the womb and hoping to shrink the fibroid. Now, it is difficult for people to talk about how well it works, but there are some studies that show that improvement in symptom can be as high as 83% in some studies or in some groups of women. And also in terms of when women come back and say they are trying to conceive, um, you find that 50% who tried compared to it 78% who tried after myomectomy would conceive. So 50%, so half the women were conceiving with this uterine artery embolization compared to myomectomy. That's when myomectomy is the one that
You
you
remove
actually do an operation to remove the
remove
fibroid.
them.
So, so those are the two sort of minimally invasive types that people
Wow.
are trying these days.
Wow. Wow.
Amazing. Amazing. Also, someone wanted
Mm.
to know, Dr. Shekzi, that will
Yes.
having an IUD increase fibroid growth.
Mm-mm.
Um, the simplest answer is because so if we break it down like this, many women have fibroids. Many women that have fibroids, it is not symptomatic,
Mm.
so it's not causing a problem. there'll be a group of women that have fibroids. It is causing them bleeding problem, and it is actually because of the fibroid. So the bleeding problem is because of the fibroid. Now, there can be other causes of bleeding problems, right?
Yeah.
That's heavy menstrual bleeding. That's what I'm referring to here. But when you know that it is because of the fibroid, then the first step would be, is it one of those type of fibroids that is actually sitting inside the womb cavity? Now, if it is sitting inside the womb cavity, it is causing the womb cavity to just change shape. It's not a nice circular shape anymore. It just has to start there. It is all that means that when the person is having their menstrual period, as the lining of the womb is peeling off and shedding, it peels off irregularly. And also that area over the fibroid where it is peeling off from, it doesn't close off the blood, the sort of bleeding vessels as well or as efficient. Now, if you were to put a Mirena coil, which is the common one, so it's a coil intrauterine contraceptive device that usually has a progestogen in it. So there are different kinds. There's Mirena, there's Jades, there are other kinds probably on the market. Now, once you insert this, it sits inside the womb cavity and it slowly releases progestogen. Now, the thing with progestogen is it is naturally occurring in women. It would usually occur sort of in the second half of your menstrual cycle. It helps the withdrawal of it helps to trigger the bleeding that you see, the menstrual bleeding. Now, if that progestogen is releasing itself into the lining of the womb, it keeps the lining of the womb nice and thin, so it doesn't thicken, because when it thickens, then it eventually has to break down and come out as menstrual flow. But if it keeps it nice and thin, then the person isn't bleeding. So now, if you put the Mirena coil in to deal with many other different causes of heavy menstrual bleeding and it is working, then it does not necessarily link into leading to an increase in the size of fibroids.
Right.
Theoretically, now, if you were looking at theoretically, there will be some types of fibroids that like progestogen, that like progesterone.
No,
Now, whilst it can be difficult to, to
know which
investigate
specifically.
a bit of fibroid, to know which type has the receptors that will cause it to increase, you will find that it is treatment failure. So someone comes, I have heavy menstrual bleeding, I've got some fibroids. You try one of the sort of first step things to do, which is put the coil in. Then that person is still getting their symptoms increasing or not reduced. Then that treatment failure would lead you to remove the coil and start thinking of something else.
Wow.
You see my point?
Yeah.
So, but on its own, to say someone has fibroids and they're using some progestogen, there'll be a reason why they are using it, either for contraception or for menstrual bleeding. And if it's not working, then it will be your answer. And if it's causing you to become more symptomatic, depending pressure symptoms from the fibroid, cosmetic symptoms from you noticing the fibroid is getting bigger and the woman's tummy appears to be getting bigger, then that'll be one of the reasons to start thinking, what are you taking? Should you change what you're taking?
Fantastic.
But very good academic question there.
Wow.
Oh wow.
Wow.
And honestly, I mean, having gone through the journey, it sometimes is mix and match. It's a trial thing, you know. If something's working, you know, if it's not working, withdraw, try something else, you know, just a bit of a trial until we get to what, you know, kind of at least is helping a bit, you know, and then, well, that's what I had. You know, I got something that's helping a bit, and then with that, because of prolonged use, I started having side effects of migraines and all of that. So that has to stop, and then try to start all over again, trying to see what can help. And it's just a long merry-go-round. But some women are lucky; they find what helps and stabilizes them, and awesome. They're good, but an ongoing journey and battle, really.
Wow. Wow. Okay, someone asked, I usually have heavy and serious pain during my period, and I really don't know what to do. What can she do?
I wish I could just give the person a nice, easy answer.
Hello, easy
Um,
answer.
pain during periods, heavy periods, sometimes other symptoms, tummy pain, feeling weak, tired, headaches, being off of your foods and things like that. They can all be linked in. They can all be all the symptoms of dysmenorrhea. So just painful periods. When there is painful periods, the way it affects everybody is different. And for some people, it's painful. They know there what sort of mixture of paracetamol and probably ibuprofen that they will take, excuse me, and they will feel well enough to, for example, go to work or school. There'll be others that when they are having their periods, that's it, they are just flawed for those 3 or 4 days. And they can't do anything. They can't really leave the house. They can hardly do at
Anything.
home even.
Mm-hmm.
So for do there'll be do so like I said, it depends on how it affects the person. It is not usual that it also depends on the person's age. So if you're dealing with painful periods in a 14-year-old girl, for example, it will be different from how you deal with it in a 24-year-old lady.
Lady.
It will also be different from how you deal with it in a 24-year-old lady that is trying to have children. And
Okay.
it will be definitely different from how you deal with it in like a 45-year-old lady. So depending on the age of the
Age.
person, there will
Hmm.
be different treatments. It
Hmm.
depends on what the person's fertility aspirations are. Because usually when you start having sort of period problems or menstrual bleeding problems, most of the way you treat it involves us giving you medications that interferes with fertility.
Mm.
And some of the only sort of two common things that they might give you that don't really affect fertility per se is tranexamic acid and mefenamic acid.
Mm-hmm.
So the tranexamic acid is aiming to help slow
So
down the bleeding. You would usually take it for the first 3 days of your bleed. And as I recall on the group, quite a number of ladies on the group have, at one time or the other, been
sister.
prescribed that with mixed response in terms of how it helped people. Then the
Mm-hmm.
mefenamic acid is to help with pain as well. Um, so if I took like the one from the start, so from the start, a young lady who's just starting her periods over the sort of previous year having painful periods, it's not unusual that when it's come to a head, especially they are missing school, they are unable to really function well, it is sensible at that stage to prescribe combined oral
Anything.
contraceptive
Mm.
contraceptive pills to help regulate the periods, and that usually makes the periods less painful. For someone who's like 24 years old, not looking to have
A
babies,
child.
at that stage, you would consider whether you want to insert the Mirena coil, so that's intrauterine contraceptive device,
Mm-hmm.
or whether the person wants to go on pills. So far, they don't have any health problems that stops them taking pills. For someone that is 45 years old that has a sudden onset of painful bleeding that is heavy, it's really important that they see their gynecologist as early as they can, because it's important that we investigate to make sure they don't have a type of cancer of the lining of the womb.
Wow.
So, and that will be to quickly check that before you start actually treating
Anything
the
Anything.
else?
bleeding,
Mm.
which you can treat in the way you just treated the other two
Mm.
ladies as well.
Wow.
Awesome.
Wow.
While we're
Someone.
here,
Mm.
before we go
Mm.
to the next question quickly, um, tell
Mm.
me your take on this, Dr. Texi. So,
Yes.
a teenager who's been
Mm.
diagnosed with like hormonal imbalance, and then she was given
Mm.
some
Mm.
hormonal pills to start to take, and then after a bit of
Mm-hmm.
time, they start to have side effects of migraine and all of those stuff. And maybe
Mm-hmm.
parents say,
Mm-hmm.
"Oh, don't take it anymore. Stop taking
Mm.
it."
Mm-hmm.
And now, so they stop taking that, but completely now the period ceased. What
Wow.
do you think? What's the next step? What would you advise?
Um, it's my first advice would be there was someone that diagnosed the hormonal imbalance.
Mm-hmm.
There's someone that started the treatment, and it is always best for that teenager to go back to the doctor. Hopefully, they are seeing someone known as a pediatric or adolescent specialist gynecologist.
Right.
And if the person, for example, is in the UK here,
So it has to be an
it's not.
adolescent specialist.
Yes, there is someone. They are usually pediatric and adolescent gynecologists, specialist gynecologists. So
Right.
basically, they deal with something like this. Starting your delay in starting periods with pain and endometriosis. So sometimes they add in like endometriosis into that their brief, and basically some of the sort of things that adolescents can have, especially in terms of starting starting intercourse, for example, and some of the problems that they have with initiating or starting intercourse, or indeed maintaining if they've started. So yeah, there are usually those sort of specialists in a number of NHS hospitals. Now, being that I used to practice in Nigeria before, most general gynecologists in Nigeria would have some knowledge as to how to manage these younger ladies
Right.
and adolescents as well. It's not unusual that it just takes us asking, just we take a good history, just find out exactly what the person is complaining about. Most times you just do a few targeted tests.
Right.
To be perfectly honest, they are not like the eureka moment. They don't tell you, oh,
This is a.
exactly. And in the early phases, it can be quite frustrating because the young girl might be finding that she's having to do a bit of trial and error
Error.
with some of medications that they might be offering.
Mm.
And as I know from Nigeria, it can be a big step for parents, indeed for young ladies themselves, to take that step of wanting to have combined oral contraceptive pills, especially when sexually active. So which can be like the thing that adds or helps balance their hormones and helps keep their periods flowing, reduces pain, and then just generally solves most of their problems in terms of unnecessary weight gain and all these other problems with acne, for example. So if only if only people are able to get access to a gynecologist, most times they can have some of these problems solved. But like for this particular scenario, I would just advise the person to just go back to their original doctor that
Right.
diagnosed them.
Okay. All right. Thank you for that. Thank you.
Mm.
So the next
Okay,
question. Someone wants to know what are the benefits of
uterine fibroid
uterine fibroid
embolization.
embolization? I know you talked about
I
embolization
think we just spoke
earlier,
about.
right?
What are the
The
advantages?
benefits,
Yes. Yeah.
So it was just like what I was saying in terms of if someone talks about benefits. So what's the main aim? The main aim is actually to avoid surgery.
Yeah.
So while it is a type of procedure, it is actually not a big major surgery. So that's the main aim. And another thing it does is it helps to preserve. You remember I said it helps to preserve like the quality of the womb itself, because you're not actually going to touch the womb. So you're not the one doing any cutting away. You're just hoping that this treatment will start solving the problem of the fibroid. Then there's faster recovery time. Of course, if you want to compare it to someone having a big cut on their tummy, moving their womb, or big cut on their tummy, move fibroids, compared to this almost like a pinprick or injection like into someone's thigh. They use it to deposit these embolization particles, and then the person is well to go home usually that same day. They would give you a leaflet explaining some of the symptoms you might get going forward. And of course, you would have had a very good and long chat with your gynecologist about the long-term effect of that treatment you're undertaking. So if you ask me, I would say that would be the big benefits. It's not unusual that your gynecologist might offer you, knowing that they will still offer you surgery. They will offer you the uterine artery embolization to just help shrink the womb and the fibroid, just so that rather than having a cut that goes up like from the bottom of your tummy coming up that way, they will just do a bikini line cut to get into the tummy cavity to do something about the fibroid. So, and which is more cosmetic. So it is not unusual that they can offer you that procedure first to shrink the fibroids.
Amazing.
Nice.
But for me, pain is pain, man. Embolization pain. My
That's the truth.
pain is
Yeah.
still pain, man. But hey, of course,
Pain is pain,
different
I agree.
choices. People, I mean, and like you said, the big thing is all about preserving the uterus, really. So if you're at the point where, okay, that's very important because you're still at the age where you still want to have children. So oh yeah, definitely embolization. You know, it's a good one to have.
Wow. Okay,
But so
before
with
I go to
embolization, Dr. Shekzi, so
Go. Thank you. Okay.
So I was
Yes.
just
Back
saying
with you.
with embolization. So I know that's supposed to shrink. I mean, cut the flow of whatever it is and help the fibroid shrink. So you want to see to her and then you can come back. You want to see to her the check
No,
and
no, no,
come
no.
back.
It's fine. It's fine.
Are you sure?
Yep.
Okay. So I wanted to find out, with embolization, is that gonna so I know it's a cut of a flow of blood and blah blah blah, and just to help the fibroid shrink and all. Is that a permanent solution or is it temporary as well?
For permanent solution for what?
For
fibroid.
fibroid.
With the uterine artery embolization, is that what you're asking?
Yeah.
Some people use it as that would be their treatment. Some people will use it as that their treatment. In terms of it just depends on, okay, so why am I treating this way? So for some people, if they have treated that way, they are treating just because they just want to avoid an operation. Many different people might have health conditions that mean that an operation can become dangerous. So an operation whereby they put them to sleep can be dangerous for them. Some people can have, just it can be just that alone.
Right.
For some people, they might just have just that fear that they don't want to have a big operation. And so yes, so they would offer them that. Very low risk rate of people getting an infection when you have this procedure compared to like a hysterectomy or a myomectomy. It's also very low risk. Well, like I said, people can still fall pregnant, but it is important to note that the pregnancy rates are reduced compared to if you open the tummy to remove the fibroids.
Right. So for
someone
some
asked
people
here,
that can be a solution to their fibroid
to
problem.
them,
But
while
some
others,
people, there can still be further, intervention that's required. Is that what you're saying?
Yes. So for some women, they would still require further intervention. So it's important to note. And
which
you will
one?
find that that's what the doctor will tell you. They will tell you that for women that I would say a quarter, so 1 in 4 women will still require a hysterectomy if
Wow.
you were to have uterine artery embolization. Yes.
Okay, so someone has asked the question in the comment section so that we don't miss it. And she says, after hysterectomy, I believe that's what she meant, your estrogen level reduces as she learns. So how does she, or how should she maintain, or how do we maintain our beautiful looks if the estrogen level reduces? That's a valid question, doctor.
Thank you very much. That's for me. I find it very, very important question there. I think one can just sort of couch it. I know it's a big topic and our time is fast spent. But basically what one just needs to understand is same thing. I bring the egg back. So with the womb, there's the fallopian tube. And then just underneath the fallopian tube there, on the side there will be the ovaries, just sort of where my finger is that way. So there will be the ovary there on either side. They remove the womb. They usually leave the ovary. They will leave the ovary behind.
Okay.
If the person is above 45, that discussion will be had. Should we leave the ovary? Should we take the ovary out? If the ovary looks a little bit odd, we might consider removing the ovaries. Otherwise, mostly once you're above 50 and you're having a hysterectomy for most any other reason, we would advise that you should remove your
The whole
ovaries,
thing.
because most women will go through the menopause by age 51. So that was the topic I was saying. It's too big to sort of talk about straight away right now. But the menopause, big topic, very important topic for many women across the world, especially as regards hormone replacement therapy. Now, it is also possible that the shock of having surgery in the area just causes the ovaries to just sort of go to sleep, and they don't function as well. So that might be what Bemusola is trying to ask about. And in that situation, what would usually happen is we would usually offer the ladies hormone replacement therapy. Of course, it depends on. Of course, it will depend on whether they are having they have any health conditions that means they can't take hormone replacement therapy. It can also depend on whether they've had cancer before as well. But yes, it is possible for women to have sort of a dip in their hormones when they've had hysterectomy.
Wow.
So quickly around that question, I wanted to ask as well. So if like one's had a hysterectomy and the ovaries are left behind, is there a possibility of early trigger of menopause?
So yeah, it is possible. Like I said, sometimes it's the shock. Surgery can be a big thing. It can be a big shock to the system. It can be sometimes just that shock that someone had an operation. It can be the shock of having an operation near the ovaries. And indeed, it can be that even inadvertently at the time of removing the womb, we tampered somewhat with the blood supply to the ovaries.
Right.
So for that reason, even though we've left the ovaries behind, to continue to provide the female hormone so that the person does not go into the menopause. Some women go into the menopause early, and some of them is right after the operation. For some of them, it can be earlier than what they would normally have gone through. So if they have female relatives, sisters that went through the menopause, for example, at age 51, 52, they might find that at age 45, for example, they now go through the menopause slightly earlier. But once you're above 40, we can't really call it premature menopause anymore. It is sort of classed as within the range that people can go into menopause.
Right. Interesting. Thank you for that. Right. Great stuff.
So, like I said, big topic, menopause, because our women across the world are living longer. They are wanting to carry on, living active lives. And doctors, gynecologists across the world, we're all beginning to wake up to learning more about hormone replacement therapy and the problems women can have in the menopause, especially as regards I'm reading here regarding how people can complain about their skin, things like not necessarily acne but dry skin, difficulty with intercourse, with dry vagina, that sort of thing. So it's coming. It's something that more and more women are waking up to, asking their gynecologists for treatment for, rather than just sitting and suffering in silence.
Right.
Wow. It's been an awesome session. An awesome session. Yeah, well, it's always an awesome session with Dr. Shegzi. Thank you so much for your time. Thank you.
Also, I mean, Dr. Shegzi, I know you'll always come back. You're part of this. You're a big partner. But I think we'll check with people in the hub, the community, and see, I mean, if we want to talk about
the hormone replacement,
and then
I absolutely think we should
to come and talk to us about that, menopause and whatever things that it is that women are experiencing and what can be done, how women can get help around that, whatever it is that's happening to them during menopause. So amazing stuff. Dr. Shego, thank you so much as always. Amazing.
It's really scary to know that you can go into menopause from age 40. Wow.
Good learning.
Yeah, unfortunately, yes.
Good learning.
Thankfully, it's not very common,
Okay.
but yeah, it is possible.
So,
And we're all lucky.
is this dependent on when you started your menstrual cycle?
Not directly, not directly. There can be some odd factors here or there, family history. It can be someone that has had operations, like I said, had the womb removed, had even the ovary removed because of fears of cancer in their family, ovarian cancer in their family. It can be people that have had fertility treatments in the past, because we notice that ladies that have had fertility treatments in the past, they appear to go into menopause earlier than other women. But the good
Wow.
news is that they are cheap, easy to afford, easy to get hormone replacement therapy. And the main thing that most good gynecologists will just let you know is best you just speak to a specialist so that they do a good carry out a good physical on you, check your history, make sure you get one that is suitable for you. Because sometimes you find that the particular symptom someone is having is not necessary for them to actually have hormone replacement. They just need some sort of vaginal lubrication only. And there are other things you can use to lubricate the vagina that does not need a hormonal replacement. But like
Wow.
I said, it's a big topic. It's the sort of thing that I suspect that quite a number of women, even in the forum now, probably in the next 20 years or so, considering the average age here, will
Absolutely,
be
but definitely that's something that you're gonna be coming
will be
back to talk to
requiring.
us about, honestly, because
Hmm.
is a thing to that women will lack some kind of um comfort or some kind of way to manage it as well. Definitely,
Yeah,
definitely. Thank you so
Yeah,
much, Dr.
especially with
Shexy.
relation to fertility. Thank you, doctor. It's been an enlightening
Thank you. Good
session.
having you here. Let
Oh,
us
as
know if you
always.
want to do the charity work in the neck of your wood. I'm just I'm just kidding. I'm just kidding. But honestly, seriously, thank you so much, Dr. Shekzi. And
you're welcome.
please, again, charity work in November. Join us, everyone. My colleague is gonna
6th,
put the link in
13th.
there in the comment box.
Yeah.
Join us in the work. Join the hub. We put all some of our juicy stuff go in there. The things that we're working on, the things that we've put together, and some of the upcoming events will always be in the hub. Join the hub, see what we're doing, support us, how you want to support us. Be part of this. Is a thing that needs to be known, that needs to be heard, and women, we need help. We need to be
Absolutely.
heard. So let's do this.
Thank you.
Be part of
Thank
this.
you.
Thank
Well
you,
done.
Dr.
Well
Shekzi.
done, everybody.
Lovely having you.
Well done, guys.
Thank you,
Well done. Thank you
everyone.
for
Thank
having
you
me.
for
Awesome.
joining. Thank you for taking out time to be here, to learn, to improve
As
your
always.
knowledge about your health. And thank you so much for planning ahead to be part of our charity work. We want to see you. We hope to see you in either the Abuja or the Lagos or London, or even your own personal neighborhood edition of the work. Thank you so much
And
and have
by the way, Dr. Sexy, if you want to join the London work, honestly, some men are working with us. At least I know 3 men who volunteered and said they're coming. Just to support the women that they love. So if you're in London, or if you're in Thurrock in Essex, or if you're in Buckinghamshire, that's where the other one is. Please, let's do this. Some men are joining the work, so you can join too.
Absolutely.
Lovely.
All right.
Absolutely. So we
All
have
right.
just
Thank you
about 20
so much.
minutes to wrap up, and we'll just say bye, everyone. Thank you. See you again next week, Thursday,
Thank you,
for
Dr.
another
Sexy.
edition
Thank you,
of an
everyone, for
enlightening session.
joining. We
Thank you,
appreciate your time. Thank you,
and bye
everyone.
bye.